If menopause has you asking, why are my ears ringing, my mouth spicy, and my skin doing the jitterbug, we're going head to toe to decode the weird stuff and share simple things that actually help. No shame, no scare tactics, and a few laughs along the way. Bring your questions. I brought receipts. Menopause 101, what's going on? Menopause is the point when you've gone 12 months without a period. The bumpy phase before that is perimenopause, when estrogen and progesterone jump around like toddlers on a trampoline. Those hormone swings talk to your brain, nerves, skin, joints, eyes, heart, bladder, basically the whole group chat. That's why symptoms show up in surprising places. Everyone's mix is different. This video is friendly info, not personal medical advice. If something is new, scary, or sticks around, loop in your clinician. Brain and mood. Up top, brain fog can feel like your mental tabs keep multiplying while the Wi-Fi drops. It's common in the transition and often improves once sleep and hormones settle. Sleep is the secret sauce here. Cognitive Behavioral Therapy for Insomnia, CBTI, is a short, skills-based program that reliably helps midlife insomnia and daytime function. And it can be done in person or remotely. If your worry brain gets loud, a few CBT-style sessions can turn the volume down and support sleep. Migraines can also change in perimenopause. For some, attacks ramp up with hormonal swings, then calm after the transition. Others shift into a vestibular pattern with more dizziness than pain. The headline, your brain is adapting, not failing. Morning light, consistent sleep windows, regular movement, and stress skills are boring but powerful. If headaches are frequent or disabling, ask about migraine-specific options. You don't have to power through. Head, eyes, ears, and mouth. Dry eyes sneak up on a lot of us in midlife. Tears can get a little watery instead of oily, so the surface dries out. Hello burning, grittiness, and blink to clear blur. Artificial tears, screen breaks, and an eye exam help, especially if you wear contacts or take meds that dry you out. Tinnitus, that buzz, ring, or whoosh, can start or get louder during the transition. The link isn't fully nailed down, but many notice the timing. Then there's burning mouth syndrome, a hot, tingling burn with no obvious cause that's more common after midlife. It's real, it's miserable, and a dentist can help rule out other causes and guide relief. Mouth dryness also raises cavity risk, so sip water, use gentle toothpaste, and ask your dental team about saliva support options. None of this means you're falling apart. It means your tissues are reacting to hormone shifts. And there are fixes. Heart and nerves, palpitations, the sudden boredom or flutter are commonly reported during the transition. They're often harmless, but we'll cover red flags soon. Dizziness can show up too. Sometimes it's true. Spinning vertigo. Sometimes it's vague, I feel off. Hormone changes may unmask vestibular quirks or stir up vestibular migraine for some people. And those split-second electric shock sensations? Many describe quick, harmless zaps, often around hot flashes. It's likely brief nerve excitability. If flutters, spins, or zaps are new, frequent, or scary, get checked. There are targeted treatments and simple tests that can calm the chaos. Meanwhile, hydration, steady meals, and slow position changes can help day to day. Skin and hair. Estrogen helps skin hold water and make collagen. As levels drop, skin gets drier and more sensitive, so itching is common. Some people feel formication, that creepy crawly ants on the skin sensation. It's unsettling but often benign. Still, check for other causes if it lingers. Smoother showers, not scalding. Gentle cleansers and moisturizing while damp help a lot. Hair can thin around the part because follicles are hormone sensitive. A dermatologist can sort options. If your personal eau de gym bag seems different, you're not imagining it. Sweat patterns and skin pH can shift in midlife. Breathable fabrics, daily showers, and a simple deodorant routine usually help. Your goal isn't perfect skin, it's comfortable skin. Muscles and joints. Researchers are calling it the musculoskeletal syndrome of menopause, a cluster of joint aches, tendon grumbles, faster loss of muscle, and bone changes that track with estrogen shifts. Many people feel stiff after sitting or wake up creaky. Frozen shoulder, painful stiffness that slowly thaws is more common in women between 40 and 60, so it often lands in this season. The hopeful part, strength training 2 to 3 days a week plus regular walking is medicine for joints, muscles, and bones. Add protein and vitamin D if you're low. If pain limits your life, a clinician or physical therapist can tailor a plan. Sometimes hormone therapy is part of that plan for the right person. You're not fragile, you're trainable. Gut talk. Plenty of us notice more bloating, gas, or swings between too slow and too fast. The science is catching up, but early reviews say gut symptoms show up around midlife, and hormone changes may nudge the gut-brain axis and the microbiome, the bacteria community that helps with digestion and more. Here's the low-risk starter kit. Steady fiber, enough fluids, unhurried meals, and a regular rhythm of movement and sleep. If symptoms are persistent, painful, or brand new for you, get checked. Not everything is just menopause, and there may be targeted fixes. Bladder and pelvic floor. When estrogen dips, tissues of the vulva, vagina, and lower urinary tract get thinner and drier. That can mean burning or tiny tears with sex, itching, leaks, urgency, and more urinary tract infections. Doctors group this under genitourinary syndrome of menopause, or GSM. The great news: local vaginal estrogen often brings major relief with minimal absorption into the rest of the body. Vaginal moisturizers for regular comfort and lubricants for sex are day-to-day helpers. Pelvic floor physical therapy can be life-changing for urgency and leaks. If you've been toughing it out, please don't. Ask about options, they stack well, and you can personalize the mix. What actually helps? Let's build a toolkit. First, sleep. If 3 a.m. wake-ups are running your life, CBTI Cognitive Behavioral Therapy for Insomnia is a short, structured program that retrains sleep timing and habits. It consistently helps midlife insomnia and daytime function, and can be done online, by phone, or in person. Warm then cool, wind down, a steady wake time, and cutting late caffeine make it work better. Next, movement. Strength training plus daily walking keeps joints happier, muscles stronger, and bones supported. For dry eyes, think artificial tears, screen breaks, and an eye care visit to sort causes. For GSM, combine lubricants, regular vaginal moisturizers, and local estrogen for strong relief. Now, hot flashes and night sweats. Hormone therapy is still the most effective treatment for vasomotor symptoms for the right candidate, especially within 10 years of the final period. If hormones aren't a fit, non-hormonal options include low-dose paroxetine, an antidepressant dose used specifically for hot flashes, and a newer class called neurokinin blockers. Fezolinetant, brand Veozah, was approved in 2023, and the FDA later added a warning about rare liver injury, so doctors monitor labs. In October 2025, elinzanetant, brand Linkuet, was also FDA approved, another once-daily option in this class. Ask your clinician which path fits your health history and budget. The goal is fewer, gentler flashes and better nights. Red flags. Get emergency help if palpitations come with chest pain, breathlessness, fainting, or you feel like you might pass out. A sudden, worst-ever thunderclap headache needs urgent assessment. Any vaginal bleeding after menopause, even light spotting, deserves a prompt appointment. New one-sided weakness, trouble speaking, vision loss, a painful red eye, or feverish severe pain also mean get seen. Trust your gut, it's better to check. Head to toe, this season can be noisy, foggy focus, dry eyes, ringing, mouth burn, flutters, spins, itchy skin, creaky joints, gut drama, and bladder bossiness. None of it means you're broken. Your body's adjusting, and relief is real when you mix smart habits with the right treatments for you. Now it's your turn. Share your best tips, questions, and wins in the comments so we can help each other. If you want more clear, kind, evidence-based videos like this, tap subscribe and send this to a friend who needs a hug and a plan. We're in this together.